Functional versus structural scoliosis is the subject of this video. Hi, I'm Dr. Shaki from Irvine Spine and Wellness Center, your Irvine Posture and Chiropractic Clinic. So stay tuned. Alright, we probably more likely know what scoliosis is. So if you look at the spine from this view, just like you're watching me, you want to see a straight line as a spine, and in scoliosis you've got different variations. In severe cases we have what's called an S scoliosis, where it looks like a C. I mean an S, not a C. And it can be in whatever direction. It can start from this way going to the right or going to the left. That's not the subject of this video. But that's what scoliosis is. Scoliosis is a side deviation of the spine. We're not talking about the curvature this way, but the frontal view. Now we have what's called functional scoliosis, meaning it doesn't have the stability, the spine doesn't have the stability to be one way or another. It changes depending on the movement. It's actually a lot more common than people realize. So when we do an assessment for scoliosis, patients standing up, we visually look at the spine, and then have a patient bend down and look at it again. That pretty much gives us an idea if this patient has scoliosis or not. Of course, on an x-ray, we can actually take measurements and know exactly the direction it's going or what the actual deviation from the norm is. With functional scoliosis, however, we don't have that luxury, and it's actually a much better, more hopeful way of dealing with someone with scoliosis, because by creating stability in movements where scoliosis actually shows up, that lack of stability in the spine in those movements can be targeted when it comes to exercises. We're not talking about exercises going to the gym and working out. In fact, I'm not a big fan of that, because almost no one is in good enough shape to go to the gym with the joints being centrated exactly where they need to be or close to where they need to be to work out a muscle. It's usually when you go to the gym and the joints are not centrated, and you add load to those joints to create more injury or potential for injury. So when it comes to functional scoliosis, what needs to happen is a series of these exercises, which is functional movement exercises. The specific one is called dynamic neuromuscular stabilization, which are the movements that babies go through to build strength, which are necessary in order for that baby to go from almost doing nothing or not being able to do anything to walking. At any rate, I think it's important we understand that functional scoliosis are a lot more common than we realize. There is hope with both, depending on when you catch it, but more so with the functional scoliosis. I hope this helped answering some of the questions you may have. If you found this video helpful, I've got a lot more videos on my channel. I suggest that you subscribe to the channel and also check out the description information in this video to get more information about my website and some of the great articles we've written on different subjects related to movement and posture. And also there is a podcast I have, Life and Health Matters with Dr. Shakib. I strongly encourage you to check it out. Thanks for watching. Take care.